is saying there's a, ooh, what do I do? I don't see this. Oh, no issue. Still here. Okay, we're good. Thank you so much. Which basically says that nature is positive. It's something positive in our life, which shifts the balance of the stress and health complaints. And the second is attentional restoration theory, which basically states that a shift of attention, nature may shift our attention to allow us to restore fatigued cognitive resources that get overused with trying to cope with just modern day life, modern stress. So those two theories were introduced in the 90s by Ulrich in 1991 and the Kaplan, Stephen and Rachel Kaplan in 1995. And those are still, I think, the leading explanation for really why and how does this work. Another assumption is that we can measure nature. That's tricky, that's super tricky. And I think that's a large, that's a big area of growth, potential growth that we have. And I think that nature can be measured in at least these three ways. Perhaps there's more, but at least these three. Quantity of nature, we can think about how much nature does a person get in terms of how much time, how close are they to nature, what amount of nature do they have, and the density of nature perhaps nearby. The second is we can think about measuring the type of nature. Is it wilderness? Is it urban, everyday, just being outdoors? Is it indoor environments that are bringing nature in, or is it some sort of replication, abstract, indirect representation of nature? And then the third is quality of nature. That's tricky. What is quality of nature, and are we measuring that? Another assumption is forms and doses. I think we can think about nature in some ways. It may be helpful to think about it in terms of what form and how much. If we're thinking healthcare, this may be a helpful frame of reference. So that's the what and the how much. And the assumption here is the most direct form of nature, outdoor, the most outdoor, and the largest dose, time or exposure, equals the strongest health benefit. So the more direct we get, the better off we are, is the assumption. There are other forms like windows, et cetera, that are important, but the assumption here is that the more direct, the more outdoor, the more positive. And then I just have some of the different forms listed here, the categories of forms. So wilderness, everyday urban, indoor, things like view from a window, sunlight, plants, and then abstract. Okay, and then forms and doses. This is really the quality question. So the assumption is that environmental preference findings suggest that savanna-like landscapes, green but not too much, with some access to blue, are preferred by people across culture. I think this is really interesting research, and I think that we may need to lean more on this research when we're thinking about quality. Perhaps, I don't know for sure. So my question is preferred landscape equal quality landscapes? Maybe. I have questions about white, brown, too green / scary nature. Where does that fit in? Okay, so now I'd like to just share some studies relatively quickly with you, just to touch base on some applied indoor versus outdoor type studies. This is my son, Jude. Some of my fonts. Okay, so how many of you find that your environment, your work environment, your office environment, or where you primarily do your work impacts how you feel and the quality of your work? Okay, I feel this way too. So what we did here is we attempted to measure that. We were interested in finding people who were sort of captive in their workspace. So we found, we used 503 desk-bound office staff. So people that stayed in the same space all day for 8 hours. And what we were interested in is measuring their space and seeing if there's any relationship between that and their stress and health complaints. So the first step was measuring, and this is tricky, and I apologize, I'm not going to go over this, but we created a tool. It's called the Nature Contact Questionnaire, which I'm glad is being used. And as an attempt to measure someone's indoor environment, specifically office environment, but it could be adapted to other environments. And basically it's asking things like percentage of time that you have a view from a window during your day, the number of plants, and the amount of time in minutes that you have an outdoor work break. They're trying to get some concrete measures of both your environment and a little bit on your behavior when you're asking about the outdoor break. So what we found in that study was we found that there was a correlation. There was a correlation between the amount of nature a desk-bound office staff person had in their 8-hour workday and their generalized stress and overall health complaints. So that was interesting. And what we also found was with this tool, we were able to sort of think about the different forms and types of nature contact. And we found that the more direct, the stronger the relationship. So the more times they had an outdoor work break or outdoor lunch, the bigger impact that had on them. So from there, we were interested in this idea of brief breaks. Is that really helpful? Is that something we should consider? So we decided to follow up and look at work breaks. And what we did is we used desk-bound office staff again that had really kind of structured days. And we said, everybody in the study, you're taking a 10-minute work break, everybody. Yay, and it's going to be at this time and whatever. And so everybody took a 10-minute work break and the participants were randomized. Half took an indoor work break and half took an outdoor work break. And they were asked for the outdoor work break to just notice their environment, not necessarily walking, not necessarily social support, just sit down and notice your environment. And we gave them a little script of, notice how the breeze feels and notice the sounds and notice what you see, etc. And what we found over that 4-week study where everybody took a 10-minute break was that everybody's stress reduced. So taking a break is a good thing. I'll be taking breaks. But what we found was those in the outdoor condition had statistically significantly more reduction. And this was a really small sample. So I was surprised to see that and happy. So following that, we were thinking, okay, 10 minutes, that's really powerful, just 10 minutes. So from there, we did a more controlled study where we started looking, again, this is where I sort of jump around. We started looking at sounds and we were looking at 15 minutes of sound. Does that impact your physiology and does that impact your self-reported stress in just that amount of time? So what we did is we had a convenient sample of students and they were randomized into one of 3 conditions. They came into a room, they put on their earphones and they looked straight at a wall and they either listened to classical music, ocean waves, or nothing. And we measured their EMG, we measured their pulse, and we measured self-reported stress over 15 minutes. And what we found was the only group that that had a drop in anything was nature contact, and it was significant in all 3 areas. So that was also telling. We found that reduction happened as soon as between the 7 and 8 minute mark. So also important to know from an application standpoint. Home flowers. Now I'm changing gears. Types of nature contact. What about flowers? We hear a lot about plants, but there's less work on flowers. So we decided to do this study, which turned into a big ordeal, but I'm still really happy to present some of the findings to you. We explored the impact of flowers on 170 women in Jacksonville. And what we told them was we're looking at stress and health among women. We didn't tell them anything about nature. So for 12 days, they received a battery of stress and mood and all sorts of questionnaires every day for 12 days. In the middle of the study, we randomized the women into one of 3 conditions, again, unknown to them. They were either in the flower condition, the luxury candle condition, or nothing. So they were sent, if they were in one of the flower or the candle condition, they were sent a thank you gift from the researchers on day 6. And it was delivered by the same florist, the same value, and it had the same note. And we sent them to the women, and then we just continued our battery of testing following that to see if just having these things present in the home made any impact. And what we found was that the women in the flower condition had a significant reduction in stress and in some of the mood indicators. We did not ask about how much they were exposed to the flowers. We just know that they were at the home. The candle, the luxury candle, the comparison group, We did not see that same effect. Okay, now I'm switching gears again. And this is the last study actually that I'm detailing here. We understand that kids, and from the book that I mentioned before, Last Child in the Woods, we understand that children now have the least amount of nature exposure of any time in history. There's estimates that range from minutes to up to an hour of outdoor time, even in urban settings. That includes like parking lots a day. So kids are really not outdoors. So we're trying to think, well, what's a practical way to possibly help that? And we thought schools. They're in schools for a really long time every day. And perhaps we can create healthier spaces in schools. This was pre-COVID, by the way, too. This has received a lot of attention during COVID. And so I'm really happy about the promise of outdoor classrooms. So the goal of this classroom was to build, the goal of this study was to build an outdoor classroom here. We didn't have much funding. We had internal funding, and we used this dirt play yard in a charter school to create a space for children to learn their language arts lesson. It wasn't a science lesson where they were hands-on doing things. It was just, you're either going to learn your ABCs inside or you're going to learn it outside. And we wanted to see if where you learned mattered for the kids. That's my daughter there sitting there. She's 15 now, so a while ago. So what we did was we had a crossover design where we had 2 kindergarten classes of 18 kids in each class and a teacher for each one. And we had a crossover design for 6 weeks that kids either learned, class A either learned in the outdoor classroom and class B was in the indoor classroom. And then the next day they would switch. And we were measuring every single day in the morning for the language art lesson for 6 weeks in those both conditions. So each child served as their own control because we measured them in both places. And these are the classrooms. So we have a very rudimentary outdoor classroom, basically with shade, a place to sit, and a chalkboard and their materials. And then an indoor classroom, which actually was a really good comparison. The classroom itself sort of checks a lot of nature contact boxes. So I was wondering if we're really going to see anything with this comparison. What we found over the 6 weeks is we measured 3 different things. We measured behavior, attention, and well-being. And what we found was that there was a significant difference in behavior. So the way that we measured behavior was the number of times teachers redirected children. It was significantly less in the outdoor classroom. And a redirection is something like, could be no words, just a snap and a point or shaking of the head, or no, don't do that. So every time they did that, we basically were tallying that information. We found that teachers redirected kids significantly less in the outdoor classroom than the indoor classroom. We saw a trend in attention. Attention was tricky to measure, but we measured basically every 15 seconds how many children were on task over a 5-minute period. And we found there was a trend towards more attention and focus in the outdoor classroom than the indoor classroom, but that was not statistically significant. And then the well-being was a hot mess. It was a disaster. So doing it again, I would change this up, but we used that tool at the bottom, that smiley face tool, and we gave it to the children every single day. So imagine after 10 days of them seeing the same survey every day, they just started drawing horns, and it was just like, I didn't know what to do with it. I was like, I don't know. I can't interpret. I'm not a psychologist. I can't interpret it. So we did speak to child psychologists and basically have some ideas for the future, but we would not use that tool that frequently. So this was really an important study and really interesting, I think, in that really the children were doing the same thing in both conditions, and we saw some positive effects. And I will say, just anecdotally, being there and watching the kids learn, you would see a motorcycle zoom by in the outdoor classroom, and I would expect all the children's heads to be completely distracted and looking at this motorcycle, and really they weren't. They were listening to the teacher, they were what she was writing on the board, etc. Whereas in the indoor classroom, you'd walk in and go in. I try to open the door quietly and sneak in, and all the heads turn back when they hear the door open. So it was just amazing to me to really see that with my own 2 eyes. So I'm really optimistic about the promise of outdoor classrooms. So some next steps, some things that that I'm interested in continuing thinking about, and I hope others continue as well. More work in measurement. I kind of alluded to this in the assumption. What is nature? What is it? So I think that's something that we need to think about. What about animals? What about pets? We think about biophilia hypothesis and weigh a lot on that, but a lot of times we focus only on landscape and we focus only on aesthetics, what our eyes can see. And I think nature may be more than that. So when we think about measuring, I think those things are important to consider. Also in measurement, correlation versus causation, where are we in the field? What should we be thinking about? This is Teddy too. So both of these, this is my youngest. Both of these settings are nature in some way, right? So how do we measure that? More work expanding. We have a lot of work to do to expand our work to priority populations, inclusion, and environmental justice. I think that includes not only the focus of our research to include diverse populations and those that need it in our research, but I think it also includes building our research teams so that all voices are accounted for, both from different interdisciplinary fields and different faces around the table. So I think that that is a really important area for growth that we should consider. More nature prescription in healthcare. So this is a really promising, interesting area. And I think feasibility, we were working on a small study in Jacksonville with Timaquan Parks Foundation, which is a non-for-profit organization supporting the parks in Jacksonville, and Mayo Clinic, a collaboration there, to look at the impact of basically the feasibility. What do healthcare providers think of this? So we have parks, they're ADA compliant, they allow patients to come. That's sort of step one, but the other side of that is, what do the clinicians think? What do they need from us? What do they need to know? Do they want to know, et cetera? So I think there's a lot there that's very interesting. And then, as I said before, more outdoor classrooms. It's such a priority area for kids. And it's a great opportunity. Schools are challenging, but they also offer great prime real estate, so to speak, for applied research. So if we can crack the code there, I think that would be a really great thing to do. Do I have questions? Right. Well, I know we're not taking questions.